body, do you say shoulders or do you say traps?
Traps.
Traps. So you have a lot of tension in the traps?
Yeah, traps and then like the neck area.
Do you feel like it's more so on one side or the other?
Right.
Okay. Do you feel a little bit debilitated with overhead press on that right side?
Yeah.
Okay. And you say you have a pre-existing shoulder injury, right?
Shoulder injury, and then about probably maybe 2 months ago, I don't know if I injured rib cage or what, but anytime I would take a deep breath on this side, it would hurt badly, and then it would shoot over to my shoulder.
Is that painful?
Maybe a little.
Thumbs down. Push up really hard. Good. Just relax everything. Good. Yeah. Thumbs down right here. Push up really hard. Oh, this is a little bit weaker, huh? I'm just gonna push in certain points here in the shoulder. Pardon my pokey fingers. Ooh. Painful?
Yeah.
What exercises are debilitating for the shoulder?
So the shoulder presses, for sure. Standing.
Bench press?
Yeah.
How's lateral raises and front raises doing?
Lateral raises, yes. So if I do overhand grip, I'm okay with that. Anything open, I can feel it. It does hurt.
What happened in the shoulder?
I was doing a seated cable row, and it was a long time ago. And then just from there on, I don't know if it was too heavy and I was not doing proper form movement, and it just.
So this is what I'm noticing, that you have a chronic impingement syndrome of the rotator cuff. So what that means is you have the ball, it sits in the moon-shaped socket, goes up and down. On top of the ball, you have the clavicle, which is also known as the collarbone. We have a really small space in between both of those things. Sometimes we have chronic scar tissue buildup and swelling build up because of the repetitive motions that we do, right? And it makes that space a little bit tighter. This is what happens when you make that space tighter. It pinches one of the main rotator cuff muscles that comes from here, shoots down to here, and it causes the first 15 degrees of abduction, also known as lateral raise.
Yeah. Wow.
So, that being said, if that's a little bit tight and it pinches it, then every time you're doing lateral raises, even front raises, overhead press is probably the worst one. Bench press, it pinches that tendon over and over and over. And if you pinch that thing over and over and over, at one point it's going to cause it to tear. We don't want that. So I'm going to scrape you up in certain areas. I'm going to shoot some electricity. I'm going to do a lot of like soft tissue mobilization, a lot of manual therapy. I'm going to adjust the shoulder. We're going to do a lot of things on that shoulder today to make it feel better. You're not going to like me though. So I'm sorry about that.
Everyone's me that it was stringing. I was like, is this normal?
So yeah, it'll make your shoulder shrug. The more that you can take, the better. So let me know when to stop.
Aye.
Okay, I'll take that as my cue. Aye.
How do I keep my hand? Wherever?
Yeah, I think you're good right there. So that is the top. So it'll make you shrug in a little bit in the front.
It's like spasms.
Yeah, it's making it move.
Yeah.
Okay.
It actually feels good.
Yeah. So what I'm getting right here is the muscle belly of the supraspinatus, which is one of the main rotator cuff muscles. The front part, just because you have some little bit of tendonitis going on there. I'm gonna get the delt right here and the posterior shoulder. The rear delt. Is that too much, or is that good?
I think that's good.
Perfect.
That's really
Yeah.
So what is this doing?
So what I'm doing here is that I'm breaking up the scar tissue buildup that you have built there repetitively throughout the course of all the training that you've done. And then you did competing too, right?
I did.
Obviously, to get to that point, it requires a lot of physical dedication to be able to get to that. Now, throughout the course of working out that much, you get a lot of trauma, and that trauma leads to scar tissue buildup, which is the way that your body naturally repairs. And it's good and everything, but it just doesn't give you mobility. that lack of mobility predisposes you to injuries such as an impingement syndrome of the rotator cuff. So I'm just loosening up all areas of the shoulder, that being the front, especially here, that pec major that makes your shoulder rotate in too much. You have rolled in shoulder, right? So I need to loosen that up, get a little bit of the delt. The insertion point of that supraspinatus here, which you probably don't like right now. And then the rear rotator cuff, which is the teres major, minor, the infraspinatus. So painful, but effective in mobility, and that's what we're looking for.
Yeah, I have a lot of my students, when we do the dynamic stretching before our workouts, I make sure we really warm up the rotator cuff.
Good. That's
a lot of people don't.
No, yeah.
They don't
scary,
warm
right?
up or do a good dynamic stretching before your workouts, and they just feel like, I'm do a couple push-ups and we're good.
Yeah.
It's not just that.
Exactly.
Right?
Working out that rear rotator cuff is key también. So I'm almost done here. That wasn't too bad, was it?
No, that was not too shabby.
Ooh.
Felt that.
Yeah. So pretty much, when you have impingement syndrome of the supraspinatus, it starts here and it shoots down to here and it hooks to the outside part of the glenohumeral joint, which is here. When you have pinching of here, it makes this act up and tighten up, which is the reason why if you have shoulder pain on the right side, you typically have neck pain on the right side as well. I'm like, wow, that's kind of weird. Well, it's because this is all not working in the synchronized fashion, so it just kind of migrates its way up. So part of that is me giving you a little bit of a hard time to loosen it up in the top part and here as well. Good. I'm gonna have you go on your back and I'm just going to stretch you out, okay? Bear with me. Good. So what you want to do is you want to stretch out one of the main internal rotators of the shoulder, which is the pec major. And the pec major is stretched out in two angles, outward like this and diagonally like this.
Oh, you're gonna crack my back.
Yeah. And then you want to stretch out the internal and external rotators. So just bear with me here. Good. That's not too painful, is it?
You could feel that shoulder, that rotator.
Yeah. Perfect. I'm gonna do a shoulder adjustment. You ready for this? Cool. Cup the ear.
Okay.
Just like that. I'm just gonna reach on back behind here, and I'm just gonna push. Okay. And one more. Good. Beautiful. How was that? That was good. Yes. Yeah. Let's have you go face down. Okay. Adjustment time. You're gonna hear a couple pops and cracks. Okay. Give me a deep breath in. All the way out. Good, good job. Bear with me. Oof.
Oh my god. Oh.
Wow. Just this top leg. I'm gonna bring it up. Let's get you a little bit closer to the edge. This way. Good. That's perfect there. Let me borrow this one right here. Hold that right there. I'm gonna put my knee here. Push it back here and support you here, so we're aligning your hips right now.
Okay, so I'm gonna stay where I'm at.
Yes, ma'am. Just relax everything.
Oh.
Good. You okay?
Yes.
Let's get the other side.
I'm nervous.
Oh yeah, don't be nervous. You'll be alright.
Feels good though.
And just relax everything. Good. You alright?
Yeah.
Cool. Let's go face up. I'm gonna do your neck, okay? This is good for like that neck tension that you have, the headaches, the right side of the neck pain. Wow. Whew.
Now you're my life.
You okay? How do you feel?
Good.
Good.